women complaining about they feel pain during intercourse. So many people want to know what could be the issue. Wako na kashida ama shida iko wapi?
Ideally, sex should not be painful. Pain is not normal. It's not a normal thing to be experiencing pain.
What causes low libido in women?
Oh, very important question. We're always talking about libido in men.
Yeah.
And sometimes we forget that women also experience low libido. Many women will... I've had a woman come to me and say, me, I've been having intercourse with my husband and I don't feel anything at all.
So guys, your tabia... please, can we turn around?
No wonder I'm treating everything.
I'm on my way to go meet Dr. K, and basically she's going to come on set and talk about women health. I know, man, you might be feeling a bit tempted to just click away from this video, but I'm here to tell you that you might learn a thing or two from this video. If you are a woman, please stay tuned because it's gonna be worth it, okay? Let's go. I am finally here, guys, and let me tell you something. The thing that drew me to Dr. K is the amazing content she's putting out on her YouTube channel and her IG. The Girls Club is popping. If you've not checked her out, please, I just plugged you, okay? Thank you so much for gracing my sex today.
Thank you, Brenda. I'm so happy to see you.
Look who's talking. I am so over the moon. I can't even explain
your content. Like, honestly, I'm in love with the things that you're doing. As in, you just get in, like the kind of things, the people, different people that you meet, like it's very, very interesting. And I actually have watched you,
Oh, thank you very much.
Right.
And I'm so happy that you're here today. You took the time. But guys, she is very busy. And right now, being here, it's a privilege, okay? So please introduce yourself and tell people who you are, what you do, all that.
Thank you so much. My name is Dr. Karen Muthembwa. They know me as, or you know me, or will know me as Dr. K. I'm a resident in obstetrics and gynaecology. That means I see women of reproductive age group, the pregnant ones, and also the non-pregnant ones. Different conditions that affect the down here.
Yes, please.
Yes. And I'm very passionate about talking to particularly women and youth, and those ones who are teenagers and particularly under 21-year-olds.
I'm really curious to know, how long have you done this for? Like, me as a kid, I always knew I wanted to be on TV or on radio.
Yeah.
Media.
Yeah.
So did you always want to be like in medicine, to do medicine? Able to tell us that?
Well, I actually knew I wanted to be a doctor in class 3. Yeah, in class 3.
Okay.
But in the meantime, as I was growing up in class 3, because I was acting and I was acting as doctor, and my teacher said, "Wow, you're such a good doctor." And when I went home, I said, I think I can be a doctor. And since then, my parents took it up, and ever since I was a doctor to them, even before I was a doctor. So I guess that kind of influenced the direction I took, and I knew I really did want to do this. At the same time, surprisingly, I used to watch a lot of Oprah when I was growing up, and also watching a lot of what was her name? The other one was younger, Tyra Banks, right?
Okay.
And just coming, every single day. And I used to practice on the mirror, and I'm like, one day I want to still do something to do with presenting or being on TV or whatever. So somehow I got the two mixed together.
Okay.
So I ended up being a doctor, and at the same time going into social media and all that. It's been how many years? Since I started being a doctor?
How many years?
From 2013. That's when I graduated. Then became an intern in 2014. And then from 2015 all the way till now, I have been practicing. And particularly, I've been choosing to, as a general practitioner, I still practice as in gynecology more than I did with other things.
So guys, I'm holding the book of questions. And you had a lot of questions. Some are funny, some are a bit personal, but you know what? I feel like we will go through them one by one. Dr. K, are you ready?
I'm ready. Bring it on.
Let's start. The first question coming from X.
Yes.
So they want to know, you've examined a lot of women. So do you usually feel a bit weird or traumatized when you examine women, say our mother's age?
it's funny how we see patients as patients, not necessarily as who they are or what age they are, because even if I've gotten a very maybe like my mother, even an older patient who's at show, they are very receptive to a younger doctor, surprisingly, and they're happy that it's actually a younger doctor seeing them. So I've never felt anything weird about seeing an older patient. In fact, I feel more comfortable. I feel like these women know themselves. They actually show you where the problem is. They are very receptive to treatment and to follow up. And even, by the way, you kind of like also almost become like friends. We don't really become friends, but become very like, we understand each other better, you know. So yes, I've seen so many. Some of them ask me, you look like my granddaughter, or you look like my, but they say, Mommy, Lakini, I have this problem and I know you are going to sort it out. So these are really pretty much the best patients I can actually say in my life or in my work life has been okay. And
so
it's
no
not
weird
weird.
moments? Wow.
Yeah.
Okay, you wanted to know that. I hope you're satisfied. And the next question, let's go on to our womanhood.
Yes.
So what causes swelling bumps or growth down there, and how can you deal with them?
Okay. Bumps can be in different places down there.
Okay.
You know that down there is not just, you know, the inside part, which is the vagina. But you also have the hairy part, which leads to the lips, and then which lead to the where the vagina and the clitoris are. So you can get bumps on the hair, like any skin. That's a skin area with hair that can develop any kind of growth or bump or razor bumps, especially razor bumps.
Razor bumps.
Yeah, which are very common, as you can see in most of our. Maybe if you've ever used a razor and you're allergic to razor itself, you'll realize that you have like a lot of ingrown hairs, which give you a bump that can be very painful and even can grow to really huge sizes. So anything in the skin can occur also where the hairy area is, because it's normal skin, which is even seen by dermatologists, by the way. Yes.
Okay.
But there are also growths that can occur either on the lips or even the inside, just at the entry of the vagina. So those are very common. Those particular growths are usually, you'll hear maybe people going for marsupialization or that thing being removed or a cyst. It's called a Bartholin cyst. Okay. It's usually just at the entrance of the vagina. It can be, you have like ducts that produce the liquid that makes you have some level of wetness down there, which is normal because of the discharge. So if those ducts are blocked, then you can have, you know, that liquid conglomerate, or what do I say, collects inside there and forms a ball. Yeah, so that's a cyst. It's called Bartholin cyst. If it gets infected, it's called now it's now an infected Bartholin cyst, which needs to be it's called a Bartholin abscess, which needs to be removed as an emergency. So there are bumps everywhere. There could be a bump because the bump is a tumorous thing, either a cancerous or a benign growth. So if it occurs anywhere, any bump should be seen by a doctor, because you're able to tell, is it this or is it this? Is there anything to worry about or so? Yeah.
Hey, I'm taking it in.
Yes.
Wow, okay. That was a lot of information.
Right?
And I thank you so much for that. Wow. Okay, guys, I hope you're enjoying this video. We're just getting started. So please do not touch that dial. Okay, according to you, what is the best birth control method to use right now?
Okay. Actually, there's no best birth control, unless we're talking about you personally or you're asking me personally. So every birth control, every person has a different birth control that works best for them. So it wouldn't be like I would tell them that you must use this, you must use this. There are many options for birth control. I will just mention a few, which of course are pretty much the ones that protect you, especially the one that protects you from both STIs and pregnancy. That would be the condom barrier method, especially for those ones who are not in committed relationships. I would say that because I know in marriage, or if you know you have a partner that you've been with for a long time, starting to go back to using condoms, it's probably not going to be.
Don't even dare ask a Kenyan man.
Yes, it's like, we're not going back. Like, what's the difference? You know. So obviously that would be the best, depending on what situation you're in. Then of course non-hormonals also are very good because they don't change anything in your body. But I wouldn't say that hormonals actually change anything in your body, because you already have the estrogen and the progesterone in your body. So we're just giving you another one so that it can control something. Either we reduce ovulation. So what we're doing is we're trying to stop you from ovulating. So it depends on whether you want it long term or short term.
We've had like a number of women complaining about having experiencing horrible side effects.
Right.
What do you think is the issue? Like, you've done your thing, but then again, you start having, I don't know, fever, weight gain, breakouts.
Yes.
So what's the issue?
Now the thing is, we can't say all contraceptives fit all. So everyone will respond in a different way. So for like, if I give someone who generally in healthy condition, they have normal regular periods, and then I gave them maybe something like the implant. The implant, we know some of the side effects is that it can cause some spotting. It will reduce your normal regular periods, so you might have experienced irregular periods. And then just because of that hormonal component, some people might experience a bit of headaches here, and some, but they should be mild. So we can only know after you've used a certain medication or contraceptive to be able to know that these side effects are affecting you. So if they're in their severe form, like you're having now you're having very irregular periods, you can't even tell when you're going for an event, something happens, those kind of oops moments.
Oh my goodness.
If it's affecting you that way, then of course we can remove it, and then we replace it with something else, either still a hormonal or a non-hormonal. But there are side effects that are really, really bad. Like if you start having high blood pressure, that is one of the risks of still using any form of hormonal contraceptive. Your blood pressure can go up, but that's why we have follow-up that you can be able to tell this side effect is affecting this person.
Please talk to that person, to that woman who feels like a bit unsure about getting any contraception. Like, Mimi, I won't be convinced. So talk to her right now.
So if you're not sure, the thing is, you just have to weigh what you are ready to handle. Whether you're ready to get another pregnancy, an oops pregnancy, or are you ready to give it a shot and try what we have to offer, because you don't have to have the hormonal if you don't want, because I think most people don't want something that might change something about them. If that is your fear, then you come, we discuss this thing, we tell you that, okay, if you don't want this, and we even tell you, we go every point we say, this one will give you this might give you this one will give it a month, and then later on you'll be fine. If you're not okay with any of those, then we give you the other options, being if you have a very regular period, you don't have to be actually on a contraceptive. You don't have to use our modern contraceptives to prevent pregnancy. If you know you have a very regular 28-day cycle, then we can be able to help you calculate your safe and unsafe days. That's still a form of contraception. It's called the natural method. So you can look at we calculate your days. We tell you that you're likely to ovulate at this time. So a few days before and a few days after, we will let you know what you can use. You can either use a condom or abstinence if you're able to. Withdrawal method also is an option, which is the male side, but it is very highly... It fails. It fails.
Baby, I can pull out. No,
Yay!
Trust me on this.
You come back with a baby, my friend. Hey, it is hard. It's not easy, or maybe they can delay coming out, and the problem is you're already in that situation. So natural method is, and then also we can help you with, you can use a normal calculator, period calculator, which can help you get the days that you're not safe from pregnancy, and that can help you. So you don't really need to be fixed to know or feel bad that you didn't use medication that you've been given by doctors. We will give you all options. You can use beads also.
Wow.
Yeah, you can use beads to calculate. So there are beads that you calculate, and then they don't calculate, you just move every day, like they're almost like the rosary. And then there are days it tells you this is the time you're most likely going to have an ovulation. So you need to know your safe days.
Kusema ukweli, I've seen the female condom. It's very big, it's very huge. It's a bit scary.
Right.
So what do you think about it? Is it effective?
It is very effective. In fact, I think we should be advertising female condoms even more than the way we advertise male condoms, because we're the ones who seem to be able to control our fertility and our safety, because it's very easy for a guy to get a condom and they actually don't use it. I've had cases where I'm not saying men are bad, but we are able to control this situation when we do have the female condom. It really empowers us, right? So it looks big because it's when you expand it, it looks big.
It does.
Yeah,
it does.
But it in real sense, it's something that is compressible, and it's compressible and can go inside. Yeah, the vagina is not. I think I've made this statement way before. Okay, the vagina is not an open hole. It's a closed. It's a potential. Let me say a potential hole. It's there, but it's closed like this. Yeah, but it has a potential to expand to levels that can allow a baby's head to go through. That's how we were created by God. So for us to just push something small inside, it's like using a tampon. It's scary, but you have a potential space for it.
And right now, let's move on to intercourse.
Yes.
We have women complaining about they feel pain during intercourse. So many people want to know what could be the issue. Wako na kashida ama shida iko wapi?
It's a very wide topic because pain is okay. First of all, it's relative. What is pain? For you, maybe what my pain is, it's not your pain. Like you don't feel pain when it's the same level of pain. So it's very subjective. So it depends on how severe it is with you, you know, because anything that goes into a space that has not had anything there, especially for a first timer, it's going to be uncomfortable. Let me not use painful, but uncomfortable. For some, that uncomfortable might be painful to them. Yeah, especially the first few times, because this is something new and it's expected. But ideally, sex should not be painful. Pain is not normal. It's not a normal thing to be experiencing pain. So if in case that you're starting to feel pain after a while and you've been doing this, then it could be many different things. Either because there's a problem with the structure. Maybe your vagina is shorter than others. Maybe there's some lacerations. You know, like when there's friction and all that, you can get pain from a cut, from a bruise. Right. Yeah. Even from the outside to the inside. You can have pain because of infection. And most of this, the one for infection, the pain is inside. Like when this person is hitting inside, there's pain. Not the pain of feeling the heat. Pain that this is pain, like it's like, I don't know how to explain, but you'd say it's deep pain. It's deep pain. We call it deep dyspareunia. That most likely is because of most likely an infection that could be going on with the cervix, because the end of the vagina is the cervix inside there. Many things also, like from psychological pain, can also occur because if someone had been raped before or has experienced assault, then they will recognize any uncomfortable thing where they used to feel pain that time as pain. And this can really, really affect their sexual life, because it can even cause something called vaginismus. Like the pain it also involves tightening of the vagina, and it's so painful that they cannot even have the penis cannot pass through at all. Yes, so such people usually need a lot of psychological help. It's not that someone is mentally sick. No, it's because of the past trauma. Wow, I hope you guys are tuned in. This is some very informative conversation we're having here today. And remember, the comment section is wide open. Feel free to drop everything you have for Dr. K, and she will be sure to get back to you. If you have any experiences you also want to share, if you have anything, the comment section is wide open. Let's move on to the next person. Wants to know what causes low libido in women. Oh, very important question. We're always talking about libido in men. Yeah. And sometimes we forget that women also experience low libido. Exactly. Libido is one of those things. Maybe those ones who don't know what libido is the urge for sex, or the feeling of enjoyment of sex. Sex is meant to be enjoyed. It's not meant to be painful. It's not meant to be forced. And libido, a lot of people experience a lot of libido issues, not just women, but also men. And even young ones, old people, they still experience issues with libido at some point in their lives, right? So it's not completely abnormal to maybe have a low libido once, maybe because you have other issues, stress, psychological problems, maybe you're under a lot of stress from your partner, from at work, and all that. Just because your mind is not there then your libido goes down at that point in life. It's not necessarily like a consistent problem. Other things that can cause libido issues is if you have a condition, diabetes, hypertension, those chronic conditions that you're also on medication, they also tend to reduce your libido, maybe temporarily, but not permanently. The other thing is if you're just not interested in your partner, you're just not interested.
Wow, that was point blank.
But it's true.
If you're
not interested, the libido will not be there for that particular person. You know. Is it true? So don't force it. You don't need to force it. Yeah. And many women will. I've had a woman come to me and say, you know, me, I've been having intercourse with my husband and I don't feel anything at all.
Wow.
Yeah, so maybe it's just the interest, or maybe the kind of pressure she's getting, or maybe, you know, even just trying for fertility and all those, that can just kill the moods, you know.
Wow.
Yeah, so a lot of it comes from psychology, but also other body conditions. And if you have any issues down there are people also are not able to reach the climax. That's also one of the things. Maybe you are interested but you can't get there. Actually, like 60% of women don't really get there all the time, but it's possible to go through you can have a therapist who can be able to assist you and your partner to be able to get to that level.
And speaking about sexual intercourse, a lot of men wanted to know, what are your thoughts about using saliva as a lubricant?
What?
Will please tell us today, because I'm also curious myself.
Well, I know many people do that, and there are many things to consider. I don't think that saliva would be the best lubricant, because ideally the best lubricant is your natural lubricant. If you're aroused enough, you should be able to have normal lubricant, which should be enough, right? But in the case where, you know, we don't know the bio makeup of your saliva, your hygiene. Sometimes some of these conditions like hepatitis and all that can be passed from one person, even through saliva. I wouldn't recommend that you use saliva, because imagine you're using a condom, at the same time now you still use saliva from the same person, they will still infect you, yeah? Then to beat the purpose.
Okay.
Yeah, so I would recommend that you can, if you really need a lubricant, then get the ones that have been made particularly not to change your down there. You have a whole system of bacteria and fungi that have to really work together. If you put saliva in there, it might change that, because saliva has its own bacteria as well. So you get women also coming back with infections and all that. So if you really have to, just use the water-based ones, like the ones we use in the hospital. They're fairly safe and they're not expensive. You don't have to go and buy the expensive ones, the ones that have been made with sugar and strawberry and chocolate.
The edible ones. To spice it up.
Yes, they might just change your under there. Yeah.
Oh, wow. Really? Oh.
Yeah. So if you have to use, don't use all the time. Use the other lubricant all the time if you really have to.
So guys, your tabia. Please, can we turn around?
The one I'm treating everything.
There you find the babies. It's just me. I trust you. You trust me. So please, if you use saliva, Team Saliva, that was for you.
Yes.
And guys, we still have more to go. And I just need to end this video here. Please stay tuned for part 2, because it's going to be worth it.